What are the most common joint diseases? Joint diseases include any pathology affecting an articulation or more, resulting in inflammation and degeneration of the articular tissues. The most common joint diseases are osteoarthritis, rheumatoid arthritis, bursitis, and gout. Joint diseases or arthropathies can be due to joint trauma, autoimmunity, infections, metabolic, or heredity. Before discussing the most common joint diseases, let's learn about what makes a joint, as this will help better understand these diseases. Joints or articulations connect the bones of the body, and their composition depends on the type of joint that can be fibrous, cartilaginous, synovial, or facet. What are fibrous joints? Fibrous joints are fixed joints that do not move or have very restricted mobility. They are made of collagen fibers and are further divided into sutures, syndesmoses, and gomphoses. Suture joints are the non-moving joints of the skull in adults and which at birth had the mobility to allow the brain to develop further. Once the brain developed, sutures lose their mobility and are held together with fibers known as Sharpie's fibers that ossify and lead to the formation of one bone, the skull. Syndesmoses are slightly moving joints that are held together through interosseous membranes such as the one connecting the tibia bone with the fibula bone. Gomphoses are non-moving joints that connect the teeth to their sockets in the upper jawbone or mandible. What is cartilaginous joint? This type of joint bones connections involves hyaline cartilage and or fibrocartilage. Bones with hyaline cartilage are associated with joints of long bones, while bones with hyaline and fibrocartilage are associated with bones such as the pubic symphysis. What is synovial joint? Synovial joints are the main joints of the body that can freely move. The type of joint is made of the synovial cavity, which contains the synovial liquid secreted by the synovial membrane and that fills the gap between the articular hyaline cartilage covering the ends of two bones. The synovial cavity and the articular cartilages laterally surround the bursa, ligaments, and tendons. Examples of this type of joint are the knees and the wrists. What is facet joint? Facet joints are joints that connect two vertebrates through their processes. Now that you have an idea about what makes joints, let's discuss the most common joint diseases. 1. Osteoarthritis. Osteoarthritis is a degenerative joint disease characterized by an abrasive wearing of the cartilage of the joint and the underlying bone tissues, resulting in the generation of abnormal bone growth from the margin of the affected joint. Osteoarthritis mostly affects the fingers, hips, lower back, and neck. It affects 10% of men and 18% of women over 60 years of age, worldwide. The causes of osteoarthritis can be primary or secondary. Primary osteoarthritis is an osteoarthritis which cause is not known. Secondary osteoarthritis is osteoarthritis caused by a secondary condition or disease such as trauma, congenital joint abnormalities, metabolic diseases, joint infections, disorders of the hyaline cartilage, endocrine diseases, neurogenic arthropathy, and aseptic necrosis. Traumas can result in injuries that lead to osteoarthritis. Congenital joint abnormalities are acquired during embryonic life or at birth, such as arthrogryposis multiplex congenital, known as crooked joints, or spondylolysis. Metabolic diseases that cause osteoarthritis are associated with the accumulation of minerals in the body, including the joints, such as Wilson's disease, due to the accumulation of copper, hemochromatosis, associated with the accumulation of iron, chondrocalcinosis, caused by the accumulation of calcium. Joint infection by a pathogen can result in the inflammation of joints that can lead to osteoarthritis. Disorders of the hyaline cartilage include diseases such as osteochondritis dissecans, known as non-traumatic loose body in the joints, can also cause osteoarthritis. Endocrine diseases such as acromegaly result in the enlargement of the joints that can cause osteoarthritis. Osteoarthritis can also be caused by neurogenic arthropathy or Charcot joint, which is a degenerative disease of weight-bearing joints. Finally, aseptic necrosis is associated with the lack of blood supply to the joints, causing necrosis and osteoarthritis. What are the symptoms of osteoarthritis? Osteoarthritis is characterized by pain, stiffness, crepitus, which is a crackling sound of the affected joint, and calcic spurs on the fingers and toes. 2. Rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease that affects primarily the joints but also organs of the body. It is due to the attack of the joints by the body's own immune system cytokines, chemokines, and metalloproteases, which are tissue-ingesting enzymes, causing inflammation of the synovial membrane and the destruction of the cartilage and bone tissue of the affected joint. The cause of rheumatoid arthritis is unknown, however, genetic factors and environmental factors, such as smoking and viral infections, might be involved. Rheumatoid arthritis is characterized by pain, swelling, stiffness, fixed deformities, fatigue, and anorexia. 3. Bursitis. Bursitis is an acute or chronic inflammation of the bursa, affecting joints of the knee, hip, elbow, Achilles tendons, and ischia. Bursitis is due to injury, inflammation, such as rheumatoid arthritis, gout, spondylitis, and psoriatic arthritis, and infection, such as Staphylococcus aureus. The symptoms of bursitis are mainly associated with pain, swelling, and limited motion of the joint. 4. Gout. Gout is characterized by the deposition of monosodium urate around and in the joints due to hyperuricemia, which is a high level of uric acid in the blood. The most common affected joints are those of the toe, knee, wrist, ankle, and elbow. Hyperuricemia is due to decreased renal or intestinal excretion of urate, increased production of urate, or increased intake of purine-rich foods, such as liver, sardines, mussels, herring, anchovies, asparagus, and mushrooms. Gout is characterized by sudden onset of pain, severe pain, swelling, redness, warmth, and tenderness. How are joint diseases treated? Treatment for joint diseases generally depends on the specific disease that is present. In many cases, however, treatment may include medications to reduce inflammation, physical therapy to help maintain joint function, and surgery in severe cases. It is important for people with joint diseases to seek treatment early to help prevent further damage and improve their quality of life. In conclusion, joints are extremely important in our everyday life as it allows us to sit, walk, pick a book to read, or exercise. However, alterations in any component of the joint can make all these simple body movements difficult to execute, particularly when these alterations affect the body-bearing joints. If you enjoyed the video, please like, subscribe, and share for more videos like this.